Hi.
Got the giggles, sorry.
She's got the giggles.
Sorry. Oh my god. It's good.
Okay, so hi again to our 10-minute coffee morning. My name's Annette Holiday, and you've met Amanda Hollingworth before.
Hello.
So what we're going to do today is Amanda's going to discuss one of her therapies, and this week it's about working with children. So over to you, Mandy.
Hello, thanks Annette. Sorry about the giggles, just yeah, had a bit of a nice morning, so it's just all coming out. Yeah, we spoke before about some of the therapies that I do, and it's just really lovely because I think you said this thing, I have children, you've got children, and when you're doing therapies with kids, it's not about getting them to label what their emotion is or regressing them to a certain event. It's about allowing them to just let it go, whatever that is, whether the trauma is or the... Oh, it's an aeroplane today, last time it was a train. Yeah, so it's about allowing children to be free of emotions or past events that's still troubling them.
Okay.
And freeing them so they can put in more positive thoughts, more positive beliefs, just be generally happier little campers, really.
Yeah, so I think sometimes, I think nowadays the modern way of thinking is that something that can happen in your childhood, even from the age of 2, can maybe affect you into your teens and adult life.
Oh yeah, definitely.
And sometimes doesn't come out till, you know, you're in your 40s.
Yeah, and the brilliant thing about a lot of these therapies, it's not about hypnotherapy and aggressing them to a certain event and making them talk about it. EFT and hypnotherapy and all these different things, it allows them to almost blow these things away, and then put in a more positive thought. And you see, if you can teach children these tools, emotional intelligence and emotional well-being as children, so they free them. Say they do get ridiculed at school for something whilst talking in front of the class. If they've got the tools to process that on a healthy way, or with a parent or somebody, then that doesn't stay in their head as if I talk in front of people, I get laughed at, therefore I don't talk in front of people, it's scary. If you can sort of process these events as they occur to them as kids, they're therefore going to grow up with fewer negative beliefs about themselves or the world. I mean, you get people that have a fear of buttons is actually no phobia. I know, it's crazy.
No, I had that one before.
No, an actual fear of buttons where I did a really specific case where a girl had been shouted at really severely by her mum, and while her mum was shouting at her, she was doing up her coat buttons.
Gosh.
So, and then something else happened. I think it's almost when they're in a rush going out, but every time the girl then saw buttons, her brain brought up the memory and associated being shouted at in trouble with buttons. Got to the point where she could have no buttons. She couldn't touch a button, she couldn't wear clothes with buttons, she had to use zips and Velcro. And you think, and the effect that had on her life, it was phenomenal.
So if somebody came up to you then with that kind of, I suppose it's a phobia, isn't it? Or it develops into a phobia, a fear. So if I came to you then and I said, look, I've got this horrendous fear of buttons, and I actually work, you know, with buttons, so it's a massive thing, how would you treat this?
With an adult, you would probably use regression to cause, where you go back to get people nice and relaxed and get people back to the initial event. But when you do that, you're in a safe environment, so you often feel safe to bring up that event and just look at it.
So if you sort of developed, or you were aware of this as a child, would the child be aware that they were actually scared of buttons as a child? You know, if that makes sense.
Yeah.
Would, you know, because sometimes children can't always process what it is they're scared of, or actually what their feelings are. How would you determine what the fear was? Excuse me, I'm going to have to cough a minute.
No, how you just asked me that is absolutely brilliant.
Excuse me.
Because say a child came to you as 9 and he's still bedwetting. They don't really know why, the parent doesn't really know why, but they're still bedwetting. So a really good technique with kids is something called the blow away technique. And you say to the child, well, you know, your conscious brain hasn't been able to resolve this, so we need to get to your subconscious brain, and just get you nice and relaxed to do that. And then we say, and also, I have spoken to your mum and dad about this, so it's the only time I'm going to talk behind your back. They have phoned me, but after that...
So obviously they've got trust. The child knows that whatever they say to you, it's between you.
Yeah, and I said, we have spoken about you, but we had to, but if anything you want to tell me, tell me. And then you often do it with the parent there. So both the parent and the child are involved as well. And then you just get them, just using a really simple technique. They look at a certain spot and then just get them to relax. And then you say, we're just going to go back in time, just going to drift back different times. And can you remember a time you felt really embarrassed? You know, so embarrassed from the ground just to swallow you up.
I think we've all got one of those
I've got
in the closet
daily basis, my life. And they don't have to label it, they don't have to tell you what it is. And then you say, well, you've got that memory and that feeling. Just take a deep breath and just blow it away. And when you feel you've blown it away, that's great, and we'll move on. So you just name almost like a list of emotions that you think are probably to do with that. And then you can say at the end, is there a word you want to use? And sometimes they do, sometimes they don't. And then you put in the positives of, hey, I've got a secret to you, that when you wake up, you're going to be so proud of yourself that all these reasons for, you'll find now that you can only have a wee whilst it's not right, or you can only have a wee while you're awake. And you're going to be so proud of yourself. It's going to be fantastic. You've done such a good job, and your confidence, and you put all the positive beliefs about this.
So I think that sounds as though really there is a way forward with children as well as adults. So you can use any therapy. So I think because these are only like 5-10 minute blogs, we'll probably think about winding it up there. But thanks so much for joining us again. A lot nicer weather today. So again, if you want to contact Amanda, she's on Lucid Therapies on Facebook. Or once the website's up and running, we will sort of have a look at putting that up as well. So thank you and have an amazing rest of the day.
Thank you.
Bye.
Bye-bye.